of the burgeoning Community Justice Department. So the contract's for $15,000, and she'll be leading a series of meetings, including one that we just had on Monday, which was a SWOT analysis, which was an internal focus, an opportunity for staff to really bring forward what they see from their on the ground detail in the weeds level. On Monday, we will have a leadership team meeting, and then she will be doing a number of stakeholder analysis, one-on-one meetings and focus groups, moving us towards a mission, vision, values, goals, and plan for integrating our work with the work already happening around the county and in the community.
Exciting.
Yeah, I'm really excited about this.
Yeah, me too.
Well, sounds good. Well, I will make the motion that we authorize the chair to sign the agreement.
Second.
All right, all in favor?
Aye. When will it be done, Chantel? Or
We're
completed?
aiming for about 6 months. So, but COVID, so March, April.
Okay, great.
Yeah. Yeah. Well, thank you.
Yeah, thank you. Good luck.
Well, you get to read the report eventually.
Yes.
Thank you.
Yeah.
All right. Next up, Leah Hickey. Nice name I didn't hear. There we are.
Hi. Sorry I was late. I clicked on an old link. So I am here to present Amendment 2 of our Public Health Emergency Preparedness contract. So a little bit of history. We have a master contract that was signed by the Board of Commissioners and our health officer back in August of 2019. And that master contract ran from July of 2019 through June of 2026, but it only provided funding for 3 years in there. So DPHHS has opted to do amendments, get a big master contract out, and then do amendments as we go along. So that was the master contract, and that was for $145,231 per year for FEP for 3 years. And then we had Amendment 1, which came about in April, and that was for COVID-19 response funding. So we were able to get $135,115 more dollars for specifically for COVID response funding for FEP. And that runs from last March until next March. And so what I'm bringing to you today is Amendment 2 on the master contract, and it does a couple of different things. It provides funding for fiscal year 23 and 24 in our normal public health emergency preparedness program. And then it also, they were able to secure some additional funding for us to hire an epidemiologist. So it provides funding for the salary and benefits for an epidemiologist for 2 years. For this grant year, which is we're already more than a quarter into, and then also next grant year. So the total is $91,811.84 for each year, but we won't actually get the funding until we hire an epidemiologist. So this year's grant or this year's funding is going to be prorated portion of that, depending on when we hire the epidemiologist. Does that make sense?
How many epidemiologists do we have?
We have none right now. We technically have none. I mean, we have people who are doing epidemiology work, but we don't have an actual epidemiologist, dedicated to that role.
Great.
Yeah. So it'll help us a lot.
Wonderful.
Okay, so these are two parts into one. I will motion to approve item 2.
There you go.
Yeah.
Yeah, I'll second that and just say it's kind of a funky funding arrangement here that we have with DPHHS, but as long as we get the dough, so much the better.
Great.
Right.
I'll just throw in there that I'll be in front of you again for the last 2 fiscal years of this master contract too.
We're glad to have you.
Okay.
All in favor?
What's that?
Aye.
Thank you.
Thanks,
Okay.
Leah.
Thanks for your
Thanks.
time. Appreciate it.
All right, Adrian.
Good morning, everybody. So what you have before you for item 3 is a request to approve a service contract with Voice Product Services LLC, which is a company that provides our NICE, and that's an acronym that I don't know what it stands for, but our NICE recording software that we utilize for the 911 dispatch center. As you may recall, this recording enables us to capture any call that comes into the 911 center, whether it's on a 911 line or one of our admin lines, as well as all of the radio traffic that is generated through the course of 911 dispatch operations. And finally, it also captures all of the data that is entered into the computer by the dispatcher. So this information is utilized for court proceedings as well as criminal investigations.
How long is this? How long are the recordings maintained for? In perpetuity or for some period of time?
I couldn't tell you exactly, and maybe Brian West, who I see is on, knows statutorily how long we're required to keep that information.
We'd follow the retention schedules, and I'm not going to be able to quote them offhand, but what I can tell you is that if they end up being used in association with an actual criminal proceeding, they'll be held for approximately 7 years or as long as the investigation is open and active. If they're not used for anything, they just end up being, transcribed and held. I want to say approximately a year to 3, depending on the nature of it, but I'd have to go to the actual retention schedules to give you a precise answer to that, Dave.
So one of the things that has been advantageous for us as we've transitioned to digital recordings and those kinds of things is it has enabled us to be able to consolidate our digital records and those recordings in a much more efficient way than previously having it on floppy disks or tapes at some point. So yeah, it's all good.
Okay, clearly something we need to do here. So I would move that we authorize the chair to sign the contract.
Second.
Great. All in favor?
Aye.
Thanks, Adrian.
You
Thank
bet.
you.
You have another.
I do. So switching gears a little bit, but also just a service contract that enables us to continue offering a service that we provide to the Missoula community free of charge, which is Rave Prepare. As you recall, we utilize Smart 911, which is a Rave product that enables individuals to create their own safety profile that essentially leverages their information when they call 911 to be able to communicate that to first responders. It could be as simple as there's a key under the mat or the security code to a gate, but it could be as complex as someone who wants to communicate that they don't speak English or that they have some underlying health conditions that would be particularly important for first responders to know. Rave Prepare is a component of Smart 911 in that it takes that just a little bit further, and it allows people to offer up information that is searchable by emergency management professionals. And so if you can envision, and this is frequently how it's used, when we have a situation where we're going to need to evacuate a particular area, we can draw a geographic polygon around that area and instantly receive information that people have offered up voluntarily for us to know. So someone who may have a mobility issue who's going to need additional assistance to evacuate, or if we have a prolonged power outage, someone who requires electricity to power medical devices. Those are some of the things that we can query from our population so that we can better serve those vulnerable populations. Additionally, it allows us, people can put in qualifications. So in the event that we had a need for additional EMTs from the community, we could type in that criteria and then we would receive that information from our population.
So how do people know how to sign up for this or use it?
It's embedded into the Smart 911 program. It's just an enhancement that we have, that we've offered for several years. So when you create your safety profile, you have the option to, as you read through there, you can provide additional information, and there's disclaimers in there about how it is utilized. So your private information that's part of your Smart 911 profile is embedded, encrypted. We can't access that under any circumstances other than when the caller or the user calls 911 from that associated device, and that unlocks their profile for first responders and 911 dispatch to be able to see. Some of the additional questions that are contained in the Rave Prepare component of that are searchable, but they don't contain sensitive type information. If that makes sense.
No, I was just trying to think of how the general layperson. Or wait, this is open to everyone, not just county employees, right?
Oh yeah, open to anyone in the community, anyone who lives within Missoula County, and the public really doesn't know the difference necessarily of what is Smart 911 versus Smart Prepare, other than when they're filling out those questions, it has a disclaimer in there as far as saying, do you want to share this information with emergency management?
Right. No, and I'm just getting at the very basic, like just so the general public actually knows this program exists and Smart 911 is a thing that we should participate in. Like, is that people?
Yeah, we spend a lot of time promoting Smart 911. But you know, I mean, it's one of those things that when we look nationally at the public's opting into these types of programs, it's a very small percentage of the public that takes kind of that proactive step to do that. We're very fortunate in Missoula County, fortunate or unfortunate, however you want to look at that, in that whenever we have these large-scale disasters, and primarily it's flooding and wildfires that drive a lot of our subscriptions into Smart 911, it's an opportunity for us to talk about it in a way that is like immediately impactful for folks, because Smart 911 is also the way that people can receive emergency alerts that are unique to their neighborhood. And so talking about registering for Smart 911 in the context of being able to receive emergency alerts relative to the emergency that's just down the street oftentimes drives a lot of people to register. And so we actually have a statistically higher portion of our community based on population that is registered for Smart 911 than other communities, but it is still not nearly enough.
I wonder if this is something we should add to one of our upcoming community council meetings.
Yeah, definitely.
Great idea.
You know, Nick Holloway from my office is kind of our Smart 911 czar, and we would be more than happy to present to that group and to give them some actionable information about it.
I move that the chair be authorized to sign the 3-year license agreement.
Second.
All in favor?
Aye. Sarah's, have we done something wrong?
No, you've done something great. I just wanted to check in with Adrian. We have a meeting next Wednesday night at 6:30 with the all community councils. Is that a good time for you, or do you want to do it the following month?
When do you need me to get back to you?
Before Monday. Monday.
I think we can make that work.
Okay, I'll put you as tentative.
Perfect. Thank you.
When is that, Sarah? Next Wednesday?
Wednesday.
Yes, Juanita,
Wednesday.
you might be the only one from the commission.
Juan's going to be the only one there.
Oh. Wow, you guys are off.
We're off.
Not off, but off adventuring, right? Okay. Is it?
Okay.
Yeah, cool. I was just going to say, do we want to? It's still important to hold it, because I was thinking that maybe we should push to next week, but things are so crazy. Let's just do it.
Yeah.
Yeah.
You can do the work of 3 of us.
Okay.
All right. Thanks.
All right, thanks. So do we have any correspondence? Any discussion items, communication needs requests? Dory.
Oh, can I just say something real quick?
Sorry, real quick. Did we vote on item number 4?
I don't know. Aye.
Aye.
Second. Aye. Yeah. Okay. Great.
Yeah, it's
Thanks.
tight now. That's good. Allison.
Sorry. I was just gonna say, heads up that tax bills are gonna be going out soon, it sounds like, and so we'll be doing some immediate release and some outreach on that. Just a heads up for you guys if you hear from constituents.
Thank you.
Thank
People
you.
love that. Yeah.
So I was just, this is Dory, I was going to briefly mention, so this afternoon is the first hearing on the approval of the YTED. And Janet Cornish, our consultant, will be presenting, but it's one of those that has to have 2 hearings. So today's will be the commission, if it chooses to, would be provisionally adopting it with, it's called in statute the first reading, and then the second reading is on December 12th. So we won't actually be approving the whole thing this time. It'll be provisional adoption, and they will have the motion up on the screen. So in their PowerPoint. I do know a couple people that are coming, who say they're coming anyway to do some positive public comment. So should be a little bit of that. Just didn't know if there are any questions about what we're doing on that today. Okay,
No.
great.
Thanks, Dory.
Good work.
Thank
for
you.
Dory. All right.
One more, sorry, I'm gonna continue. So I have a proposal out to the city on the what we're calling the annexation moratorium. I haven't, I don't know if I like that word or not, but I haven't got a response back. I pulled up the previous sewer contract on the Y sewer and put some information in there. One thing I think is important that I'll bring up at the meeting today is not very many of the properties out there have connected to the sewer, and it would be in the city's benefit for them to connect to the sewer. And one of the reasons they put in sewer there was because of protecting the aquifer. So I'm hoping that will be incentive for the city for the annexation question. Is we really, I believe that the YTED, even though we won't be connecting people to the sewer, by improving roads and the other infrastructure, will encourage sewer connections. So I haven't got any response back.
So I wonder if it's too late to change the name of that. I think it's going to be received differently if it's called annexation moratorium or something like annexation scheduling for the Y area. So it doesn't quite arrive on fire. You know what I mean?
I just saw that in a PowerPoint yesterday, so I will ask her to change that because I had that same kind of reaction.
You can go whatever way you want, but my first idea was annexation scheduling because it's fairly benign. And the idea here is that through our TED, we're going to make a bunch of improvements and bring on a bunch more tax-paying industries in that area, and it would be great for us to reap the benefits of that for a while before they join the city.
Thank you. I will. We'll make that change.
Great, thanks.
Might I also suggest annexation cadence? Cadence is my new favorite word. Just throwing that out there.
A little rhythm.
makes the targeted economic development district. You can come up with a jingle.
We should add another thing to pass here, that all new resolutions be an iambic pentameter. Be the first in the state to speak.
Right.
Thank you.
Thanks.
You just made a theater nerd very happy, Josh. Thank you.
So do we have any COVID-19 stuff that we haven't yet talked about?
I guess I would ask you if there's anything you're curious about. There's a couple things I'll put on your radar. As I mentioned last week, we did receive and we did get the check cashed for our EOC expenses March through June. We also just yesterday received approval and what they call obligation of our NCS costs for the same period. So we should be expecting a check for that in the next coming days, maybe early next week. And then we'll be submitting costs for June through September here very soon. July through September very soon. The thing that just to put on your radar is that, as you may recall, very early on in the pandemic, Governor Bullock announced that for FEMA PA, which they call public assistance, which is what we are accessing, 75% of our costs get reimbursed back to us by the federal government, and that remaining 25% is historically borne by the local jurisdiction. But the governor made an assertion early on that the state would cover that 25%, and they're using their CARES funds to do that. And so the new administration, and with the end of CARES funding coming at the end of the calendar year, as we continue through this, there may be an expectation back to the local government that 25%. So just FYI, I don't have any additional information on that right now, but just something to think about. Along non-congregate shelter, we continue to just operations normal there. We're doing some surge capacity planning right now in anticipation of a lot higher numbers in the winter. We don't really have a good overflow option right now, so we're looking at how we're going to start triaging and making some tough decisions as we go into winter, and some pretty awful forecasts that we're looking at. So more to come.
Adrian, any how is reimbursement congregate shelter?
So that's the one that I just mentioned, in that we just got that obligated. Yesterday we received word that our request had been obligated, but we have not been paid for that. You know, it's a new program for FEMA. It's a new program for all of us. This first submission was an opportunity to really figure out how to square away our submissions to maybe streamline a little bit more. We had a lot of back and forth with FEMA as far as the costs that we'd incurred up to this point. All of them were approved, but it was pretty time consuming. And so we're hopeful that in this next submission that we'll have that kind of just squared away. So it's pretty straightforward. What we saw with this last submission is that it was about a month and a half turnaround time, which is really quick. And then we hope to see that going forward.
Great. That's fantastic. I remember at the beginning there was some nervousness around turnaround time.
And we should still continue to be nervous around that. You know, there's lots of factors at play, and while we were lucky to have the turnaround that we did, I don't know that will be repeated, but we're hopeful.
Thanks.
Yeah.
Thanks.
All right. Do we have anything else?
No. Or actually, who was all on? I had asked Allison if we knew the gender and age of the 9 folks who've died in Missoula County from COVID-related complications, and does anyone know by chance?
No.
I don't. Oh, go ahead, Allison.
Oh, I was just gonna say, I think if you guys would like to know that information, we can get it, but I don't think it's anything they're gonna release publicly or.
Got it.
So, yeah.
I think we're meeting with the health department in half an hour. We could probably
Oh,
ask-
we are. Oh, someone did not read the schedule.
We had a really good small committee meeting yesterday with the health board that I felt like, man, was long overdue and made real progress. So I'm excited for our conversation today.
Oh, great. Thank you. I didn't realize what we were doing.
Commissioners, I'm sorry, I'm unable to attend the health update meeting at 11 because I'm leading a Leadership Montana discussion for an hour. I can't cancel. It's been advertised for a really long time. It kind of aligned with Chris's surgery, so sorry about that. I would normally be there to support you in that, so please let me know if there's anything that comes from that you need support with.
Thanks. I bet we'll talk about it at our end of week combo today.
Oh, perfect.
Sounds good.
Yeah. Great. Well, with that, I think we are adjourned. And Andrew, I just had a couple bonehead commissioner questions for you.
Yeah. I was just going to tag on to something Allison said earlier about the property taxes. They're going to start being mailed tomorrow, and they'll be mailed into next week. As they come out of the printer, they're going into the mail in segments, so they'll And you can see all your new property tax bills online right now.
Great.
Okay.
Yeah.
Thanks.
You bet.
See ya, everyone.
See everybody.
Thank you.